This is Peter J. Pollack, MD, with another Medical Practice Trends podcast. And our guest today is Mike Meikle of Hawthorne Group, a Richmond, Virginia consulting firm. Welcome, Mike.
Hello, Dr. Pollack.
Our topic today is physicians who choose a direct pay model over insurance compensation. Can you explain what is meant by the direct pay model?
Well, at its core, the direct pay model is a physician or medical practice that is no longer accepting health insurance, that they're moving to cash-only transactions or credit card, etc., and they're bypassing the whole insurance compensation scheme. And there's quite a few reasons behind physicians choosing that route.
I guess this has been around for a couple of years. It has names like boutique practice or concierge practice. And this is primarily for primary care, internal medicine?
That's correct.
Okay. Have you seen this in some of your clients, and what do you think their motivation is for doing that?
Well, the trend itself, I think, is too small right now to measure effectively that, X percentage of physicians are moving toward direct pay. But looking at the recent press about it, I think it will be a growing trend. And the reasons behind it are several reasons. One is physicians are at a certain stage in their life cycle, either they're getting ready toward retirement or they have a significant client base, and they're looking at the cost of implementing an EMR solution, and they're looking at their various options, and they see that not only with the meaningful use regulations that are being applied to EMR and Medicaid and Medicare reimbursements, they believe, doing their own cost-benefit analysis, that, hey, moving toward a direct pay model where I can see, say, 15 patients a day and they know exactly what I'm going to charge them, and that seems to be a more cost-effective solution for me. Also, doctors, if they move toward a direct pay model, are no longer going to have to deal with the insurance compensation model, which, of course, has enormous bureaucratic overhead, administrative overhead, that not only are they have to deal with all the paperwork when they get compensated by an insurance company, but it's almost like a price-fixing scheme. The doctors are going to be paid X, that's it. And many times that particular fee is, in their eyes and in many, below market rate, market value of the service. So with the direct pay model, they can charge what they believe that the service is worth, and then they can have paying clients who they know they're going to be paid on immediately instead of waiting for many months before they get compensated for their service.
I've heard that some of them actually have a sort of a membership where patients pay a monthly fee or a yearly fee, and then they have access 24/7, basically.
That's right. And there was a couple practices I've read about in New York, especially in New York City, that are like that. You'd pay X number of $1,000s a year, and you have, it's almost like, I guess to use a more flippant example, like a health club membership. You have availability to call in the physician and get services. You've paid your membership into the practice, and therefore you have access to that person's time. And that's also guarantees, especially if it's a yearly or monthly based model, it guarantees a specific revenue stream for the physician.
Sure, that's great. Okay, well, Mike, thanks very much. We appreciate it.
Thank you, sir. Appreciate your time.